Our community spotlight this week is from the Area 3 Senior Services Agency. Really pleased to have Raul Enriquez, the Executive Director of the agency, here to share with us today some information about the organization, what their mission is, what they do. So I'm not going to steal his thunder. Raul, welcome. I'm going to allow you to introduce yourself, the members of your team that are with us this morning, and I do have your flyer up if you want me to share it. So with that.
Yeah, so I'm the Executive Director of the Area Agency on Aging. I just love what, the organization that you have here and how it highlights community education and the focus on free and quality. It is really, I guess, resounds with me because I'm an information guy. I started in this field as a case manager. I would visit seniors right out of college with my degree in social work. I was visiting seniors, helping them, providing case management and providing them with resources and helping them sign up for signing up for programs. And so we're a part of 6 area agencies on aging, and the reason I bring that up is we do not cover Twin Falls. So if any of you cover that area, you wouldn't call me for the programs that I'm about to go over. You would call the area agency on aging in Twin Falls, and so there's 6 of us located throughout the states, and these are the different regions. The area 1 is in Coeur d'Alene. Area 2 is in Lewiston. I'm in Meridian. The area 4 is in Twin Falls. Area 6 is in Idaho Falls, and area 5 is in Pocatello. So we get federal and state funding. We get Older Americans Act funding, and we also get funding from the state, which is authorized by the legislature. So our mission, so it's a huge run-on sentence, just like most mission statements are. But I'm just going to go over this, and I'm going to kind of break it apart because I think it's important. Our agency provides solutions for seniors and caregivers aimed at securing safe, healthy, community-supported, and independent living options through comprehensive information, assistance, advocacy, and planning efforts. That's a huge mouthful, but I think the things that are important that I want you to walk away with is that we provide solutions through providing comprehensive information and also through planning. So similar to what this organization does, we are adamant about education. We're adamant about resources, and my overall objective is to be a centralized hub for long-term care resources. So with our staff, we from the beginning, from when they start, we emphasize that the information needs to be correct and accurate, and also that the person that they're interacting with gets all information, not just one resources. We make sure that they're if we understand that they're eligible for multiple programs, we'll give them the list. Give them a list of resources so they can decide for themselves. We also do a lot of planning. We work with other organizations, and we have multiple grants and pilot projects that are going on right now. We're in charge to serve a specific group, and the group that we're charged to serve are people that are at risk for nursing home placement. And statistically, what we know is that people that are low income, that are minority, that are living in a rural area and living alone, people that are in that demographic will more than likely end up in an assisted living or a facility over other groups. So we specifically target people in these areas. Okay, so here's a list, and I'll get this PowerPoint out to all of you. Here's a list of the different types of services that we have. We categorize them into two categories. That is direct delivery. Direct delivery means I actually have staff that work for me that provide this service. A lot of you probably may have not have heard of. I was looking through the list of people on the call, and there was a lot of names that I didn't recognize. And typically, when I'm in presentations or conferences, there's people that I recognize, and I think that's great. So this is a group that's new for me, and it's great to see new people getting exposed to the programs that we offer. So you may not have heard of us, the Area Agency on Aging. Maybe you have, but you may have probably more than likely have heard of my staff. So in particular, adult protection. So if you've ever called someone in for an adult protection referral, or if you're in a facility, if you work at a facility, you more than likely have heard of our ombudsman. And those are the staff that work for me. So these direct delivery services are actual staff that work for me. On the contract delivery, I have contracts with providers throughout the Valley for different programs. So we have, I don't know, I think we have about 24 contracts with different senior centers. And then we reimburse them for the meals that they provide. So that lunch meal, or if they do Meals on Wheels or home delivered meals, we provide the funding for that. And there's also other programs that we contract out. And so I'm going to go over those programs. I just wanted to give you kind of an overview of what we look like. Information assistance. So Ricky Sotabin is on the call. She is actually the supervisor for our information assistance staff. We have a call center of people that are answering phone calls and connecting people to resources on a daily basis. So we're open from 8 to 5, Monday through Friday. So if you are looking for a service, I would encourage you to call. I think if there was anything that I would leave you with is to call information assistance if you're looking for services. They have a variety of resources. They have access to a lot of resources. And you know, they're very creative and they have a huge imagination to connect people to solve problems. We have a contract with Metro Community Services, and they actually provide Medicare benefits counseling. There's a lot of Medicare benefits programs that people qualify for that don't access. So we have that program. Again, home delivered meals. When I send this PowerPoint out, you can actually see here, we kind of list out what the eligibility criteria is for that. And so you'd be able to use that to determine if a person's eligible or not. We also have a Homemaker Program that provides assistance with housekeeping, running errands, laundry, making and changing the bed. We also have transportation contracted services. So we contract with various providers to provide transportation services. We also have a respite and caregiver support. We have a couple of programs for caregivers. We provide a person that will come to the person's home to provide relief to a person that's taking care of somebody full time. And that's for unpaid caregivers. We also have a program called Powerful Tools for Caregivers. We have a contract with Janice, and that is a workshop to help caregivers to provide self-care. Again, the lunches at senior centers are also funded by us, and so there's the eligibility criteria with that. The health promotions program, we have two different workshops. One is managing diabetes, and the other one we have is managing pain. And that is one of the things that we talked about with your guys' organization to provide education that you might see coming your way soon. Manage pain. And again, you'll be able to see that information. Adult protection. Again, so it's anybody that's 18 or older that is vulnerable, that has been identified to experience abuse, neglect, self-neglect, or exploitation. We also have ombudsman. They're kind of a mediator or an advocate for people that live in long-term care facilities, and so they go out and advocate for residents' rights. We also have a contract with Idaho Legal Aid to provide legal assistance for people 60 and older. So with that, I kind of breezed through the last. There's the telephone number again. If I were to leave you with anything, you can contact us through email. You can contact us through phone. There's a toll-free line. Please pass this information out to the people that you work with. Again, if there's anything that we could do to help the people that you work with, please give us a call. Again, there's a Facebook page, and we also have our website that has a lot of this information as well. So,
one question for you, Raul. Thank you very much. One question for you: is there an income eligibility requirement, or is this available to everyone?
This all of our programs, with the exception of Homemaker, there is no income eligibility. So they're not what they refer to as means tested. The Homemaker program, it doesn't determine whether you're eligible or not. It does determine what share of cost you will have. So it's based on a sliding fee. But we don't qualify or disqualify people based on their income.